For anybody who doesn't know me, my name is Dr. Jason Banta. I'm the Extension Beef Cattle Specialist at Overton, and I want to welcome you to the Ag in the Evening program for tonight. Our topic is internal cattle parasites, and we're really going to focus on intestinal worms as well as liver flukes. So just to get my disclaimer out of the way, I am going to talk about some products tonight. It's a little easier to talk about products in addition to just the active ingredient. So just because there's a product in the presentation doesn't mean we're trying to endorse it, or if there's one not in the presentation doesn't mean we're trying to discriminate against it. So when we think about internal cattle parasites, there's several different groups. The group that most people probably think of is what we would refer to as the gastrointestinal nematodes, or gastrointestinal roundworms would be another name for them. All we mean by gastrointestinal is gastro would be the main stomach that cattle have, or the true stomach they have, the abomasum. And then intestinal, we're talking about the small intestine primary there. When we're talking about these gastrointestinal nematodes, there are a lot of different species, and that can be important at times. So we'll talk about some of the major ones tonight. Other internal parasites would be things like lungworms, tapeworms. I mentioned liver flukes, which we're going to spend some time on tonight, coccidia, as well as grubs. So why are we worried about gastrointestinal nematodes? What kind of negative impact can they cause? Well, they'll cause cattle to have a reduced appetite. We'll see reduced digestion and absorption of nutrients. That's going to lead to reduced performance. So when we're talking about calves or yearlings, we're talking about reduced growth rates. When we're talking about cows, we're talking about reduced body condition score, which can lead to reduced pregnancy rates. And then they can have a negative effect on the immune system as well. And all that's going to lead to reduced income for the operation. So how do cattle get infected with gastrointestinal nematodes? Well, the adult worms, they're going to shed eggs. Those eggs are going to come out in the manure of those cattle. Those eggs are going to hatch. Then when we get rain, that rain allows those larvae to exit that manure patty and crawl up that blade of grass. And then when cattle consume that blade of grass, and we're talking about grass that's been wet or is currently wet, then they're going to be infected with that larva. So I mentioned wet grass because during drought conditions, we don't see near the amount of worm transmission as we do when we have wetter conditions. When we think about those larvae crawling up that blade of grass, we will see that the concentration changes as we get higher up that grass. So some estimates that have been made is when we talk about forage that's 4 inches or taller, only about 10% of the larvae are found above 4 inches. From 2 to 3 inches, about 15% of the larvae. And we're talking about less than 2 inches, that's where 75% of those larvae are going to be. And so if we don't graze our pastures this short, we can actually reduce transmission just through grazing management. The other thing is those larvae are going to be located right around where that manure patty was. And again, overgrazing would increase infection there, because if we don't force those cattle to overgraze, they'll naturally kind of stay away from those manure patties. But when we are causing them to overgraze, they're going to graze right up to that manure patty. And so they'll get infected with higher rates of larvae at that point in time. So kind of 3 gastrointestinal nematodes we're going to focus on tonight are going to be Ostertagia, Haemonchus placei, and then there's going to be several Cooperia species, but we're kind of going to treat them as one tonight. Important thing to note about the Cooperia species is they just tend to be a problem in cattle less than a year of age. Once cattle get over a year of age, they're not near as much problem, whereas Ostertagia and Haemonchus can be both problems in adult animals as well as calves. So when we look at Ostertagia, we would consider it to be a cool season parasite, and that's going to refer to when we're going to see transmission of it. It's generally considered the most pathogenic as well as the most important gastrointestinal nematode. It causes cattle to eat less. It will have impacts on digestion. It can also cause some bacterial infections in the abomasum at times as well. As I mentioned, it can be a problem in both adult animals as well as calves. And it does require cattle a little longer period of exposure before they start developing some immunity to it. It is a poor producer of eggs compared to other species, and that's important to keep in mind if somebody's talking about fecal egg count data, is just because you have a lot of eggs doesn't always tell you how big of a problem you have, because Ostertagia causes a tremendous amount of problems, but they don't produce a lot of eggs, whereas we have other species that produce a lot of eggs but may not cause as much of a problem. When we think about when do we generally see the greatest infection with Ostertagia, for us, it's typically going to be from March to May. We'll see transmission all during the fall and winter, but peak transmission is going to be during March to May. So really right now and for the next 60 days or so. When we think about Ostertagia, what's going to happen is those adult worms reside in the abomasum. And when you think about cattle, people talk about four stomachs. I'm going to kind of call it four compartments. But those first two compartments would be the reticulum and the rumen. That rumen is going to be the biggest part of it. Then the next compartment is going to be the omasum. And then the last of what people refer to as those four stomachs would be the abomasum. The abomasum would be more similar to like a stomach in a monogastric, like a pig, for example. So those adult worms, they're going to live in the abomasum and they're going to shed eggs. Those eggs are going to come out in the manure patties. They're going to hatch, and those larvae will go through different stages of development. And when those larvae get to what we call the L3 stage, that L3 larva will actually climb up that blade of grass, and then it's consumed. And then that L3 larva will actually enter the gastric glands of the abomasum. So that's little glands in the stomach that secrete enzymes that help break down food so cattle can absorb those nutrients. And that's where those L3 larvae will go into those gastric glands. While they're in that gastric gland, they'll go ahead and develop into an L4 larva, and then they'll continue to grow into immature adults as well. Now, at certain times of the year, when we're talking about the summer, when it's really hot, instead of continuing to grow, those L4 larvae may become what we call inhibited. So they'll kind of stop their growth until we get into the fall of the year and conditions get more favorable for survival of the eggs that they would be shedding later. Those L4 larvae, like I mentioned, will develop into immature adults. They're actually at that point in time going to come out of that gastric gland. And when they come out of that gland, they really cause a lot of damage, which is why we see that reduction in digestion and absorption of those nutrients. And that's going to occur whether it's during the winter or if we talk about the inhibited larvae that kind of stop growth during the summer, then they'll emerge in the fall. When we talk about Haemonchus placei, it's considered a warm season parasite. And so typically transmission is going to occur from April to November in Texas. So kind of think about when your Bermuda grass or your Bahia grass or your other warm season forages are growing, that's when we get the most transmission from Haemonchus placei. It does suck a tremendous amount of blood. It lives in the abomasum. And in contrast to Ostertagia, it's actually going to produce a large number of eggs. And then when we talk about a Cooperia species, we have both cool season and warm season Cooperia species. They produce a tremendous amount of eggs as well. They actually live in the small intestine. So we would have the abomasum, and then the next part of the digestive tract would be the small intestine, which is where they're going to be. When we talk about this species, it's important that we understand that some of our traditional dewormers that we normally think about have never worked very good on this group. The group of dewormers that work better on the Cooperia species are our white dewormers, and we'll talk about them in more detail a little later. And then cattle generally, once they get over about a year of age, tend to have pretty good immunity to the Cooperia species and really don't have much issue with them. So this is a group we're really going to focus on those younger animals, especially those weaned calves. So when we think about our anthelmintics, and anthelmintics is just the term that's used to talk about dewormers, it's important to understand some differences. And then it's also, I think, kind of interesting to look at approximately what point in time did discovery occur of these various anthelmintics. So Levamisole was the most current one of the products that are still available, and it was released roughly around 1966. It's either an injectable or a drench is the way you're going to find it. The next three there, albendazole, fenbendazole, and oxfendazole, are all what we would call our white dewormers. And typically they're going to be found as drenches, as well as in one situation as feed additives, and we'll look at that. But they would have come on board sometime around the 1970s. And then when we think about our macrocyclic lactones, which is probably what most people are going to be familiar with, ivermectin was the first product. It's actually considered a first generation product. It was developed by a joint effort between Merck Animal Health and then an institute in Japan. And that research and development occurred in the 1970s. And then our second generation products would be aprenomectin, moxidectin, or doramectin, which that would be, the brand names would be Epernex, Cydectin, and Dectomax there. Aprenomectin, they actually kind of discovered first, but really didn't come on the market until around 1997. And then moxidectin and doramectin would have been in the 1980s. So when we look at those groups, the first chemical class we're going to talk about is the nicotinic agonist, and levamisole would be the product there. Levamisole by itself is going to be sold as a drench. It used to be sold by itself as an injectable, but the last time I checked, there's no straight injectable levamisole on the market, but there is a combination product that has levamisole in it. Our benzimidazoles are what most people refer to as the white dewormers. When we talk about valvicin or synanthic, they're going to come in only a drench form. When we're talking about safeguard, it may be in a drench, it may be in a paste, or there's multiple feed forms, like you can buy it in a block, you can buy it in a cube, you can buy it in a mineral as well. But those would be our white products, and those are the group we're going to talk about that really work well on the Cooperia species. When we talk about the macrocyclic lactones, and these would be what I would refer to as the pioneer products, that's just the initial products. It doesn't include generics, but realize any of the generics of these would fall into this category as well. And so that would be Ivomec, Epernex, Long Range, Dectomax, and Cydectin. Long Range is the same active ingredient in Epernex. It's just formulated in a way that when you give it, it releases one dose, and then roughly 70 days later, it's going to release another dose. But all these are in the same chemical class. So sometimes people think, well, or decide they want to rotate, and they go from Ivomec to Cydectin. Well, all you really rotated is what company you're buying that product from. Those products would be in the same chemical class. So it's important to understand the chemical classes if you are concerned about rotation. I'll tell you later on with dewormers, we don't have the same concerns with rotation like we do with the hornfly control products. Interesting thing about all these macrocyclic lactones is they're actually produced from bacteria that were found in the soil. So either a derivative of the fermentation that comes from that bacteria or directly from fermentation products. So people always kind of wonder, and there's discussions about natural products or synthetic type products, but interestingly, they all originate from some type of a bacteria product. So when we talk about timing and frequency of dewormers, it's really important to look at rainfall as well as geographic location. So if we just take Texas for instance, the way we need to deworm is going to be different in East Texas than it is going to be in West Texas from a rain standfall. When we look at the Southern United States versus the Northern United States, the number of and time when and the number of times we're going to need to deworm is going to change. Basically, the higher rainfall we're looking at need to deworm more. In lower rainfall areas, we may not even need to deworm at all. So if we look at transmission patterns in the northern states, if you look, not much transmission from December to about April, and then they have transmission from May going into the fall. Makes sense when you think about temperatures in those northern states. When we think about the southern states, we have that same pattern, but then we also have another pattern where we see transmission of certain species from February to May until it gets really warm, and then they stop and would pick back up in the fall. So when we think about that, how do we need to strategize as far as the timing of our dewormers? So especially with Ostertagia, remember that's the one we talked about being the most important, that it primary transmission was from March to May, and then when it gets hot, it shuts down. Now, if we have a really wet June, we'll see transmission move out into June a little bit more, and so we may want to delay our worming just slightly in those really wet early summers. But what we want to do is strategically deworm. So when the majority of those worms are in the animal, we treat there. And so we get them killed. And so they're not increasing the numbers out on pasture. And then also with Ostertagia, most of the Ostertagia, the way they survive through the summer is actually in the animal. And so if we can come in here and get them dewormed at the right point in time, we can really have some beneficial impacts on overall numbers in the pasture. And then when we look at Haemonchus and some of our Cooperia species, you see they're actually transmitted during the summer. And so we're going to want to come in here and deworm November or December. That's when we need active ingredient of the product in the animal. Now, depending on the residual activity of the actual dewormer we're using, we may can adjust our timing a little bit, and we'll look at that more here in just a second. So when we think about strategic deworming for Ostertagia, if we're using one of the white dewormers, they don't have any residual activity on Ostertagia, so we would need to deworm June or July. If we're using one of our macrocyclic lactones like Cydectin, Eprinex, or Dectomax, they have 28 days of residual activity on Ostertagia, so we can look at late May or the first part of June typically. If you're looking at long range, we're looking at 120 days of residual activity. And so you could back that up into March or April to get the most benefit out of that product. When we think about deworming our young animals, we want to use a white product sometime around weaning. So don't necessarily want to run those cattle through the chute on the day we wean them, but maybe we deworm them a few weeks before weaning, or maybe we want to deworm them a couple of weeks after weaning. Probably ideally before weaning would be slightly better, but just depends on what makes most sense for your operation. Definitely need to use a white product to take care of the Cooperia. And then a lot of times we'll use a combination of both the white product and a macrocyclic lactone. So we take care of the Cooperia with the white product, and then we get some residual activity out of the macrocyclic lactone as well there. So what are some things we want to think about from a product selection and purchasing consideration standpoint? Well, first, we need to understand the active ingredients and all the products that are available out there. So I put these together because especially over the last 3 years, the number of products that have become available has increased drastically. So when we look at ivermectin injectable or ivermectin injectable, we have the brand name product here, which is actually Ivermectin Plus. So it's the ivermectin, and it also has something in here for liver flukes, which we'll talk about later. To my knowledge, brand name straight Ivermectin injectable is not available at this point in time. So if you're just wanting ivermectin injectable without the liver fluke product, the options would be these 3 generics up here: normectin, bimectin, and agromectin. When we look at generics from the Ivermectin Plus, again, normectin has a product, and then there's a bimectin plus. I will tell you with the some of the generic Ivermectins, we have seen some pretty significant failure issues, both from field observations and in some research trials. So that's something to be aware of if you're thinking about ivermectin. From a poron standpoint, we have straight brand name Ivomec poron. There's also products or normectin, bimectin, and then ivermectin would be some generics in that issue, and especially where we saw some of the issues were with some of the generic poron products. Moxidectin is another one of the active ingredients in the macrocyclic lactone group. That would be Cydectin poron or Cydectin injectable would be the two brand names there. And then Terramox is a injectable generic that has come on the market here recently. I haven't seen really any data to know if we're going to have the same concerns with some of these other generics as we did with the ivermec generics. Eprenomectin, Epernex would be the first brand name product there, and then long range would be another brand name product, and then there's a couple generic poron products there as well. With Doramectin, Dectamax would be the brand name product there, and you can get that in an injectable or a poron version. And then I mentioned there was a combination product with Levamisole earlier. So that would be this product called Valcor, which is Doramectin as well as Levamisole. They're both. There is a generic Doramectin product, injectable, and then a generic poron product as well. When it comes to the long-range product we mentioned earlier, you do need to use a special syringe for it. So you can either get a syringe like the one on top and actually connect it to the bottle, or if you prefer to use like a repeating Allflex syringe, you can buy a barrel replacement and change those barrels out there. Now, these syringes with the tubing work good for things like dewormers or vitamin injections or something like that, but we want to remember we don't ever want to use those from a vaccine standpoint. The other thing to realize is some of our products are not labeled for bulls, or there may be some age restrictions on calves. So neither long range or Valcor are going to be labeled for bulls. So that's very important. You're going to need to use something else for the bulls in your operation. And then also both of these products are going to require a prescription from your veterinarian to purchase them. So always make sure you check those labels and see if there's any kind of restrictions as far as the animals you want to use the product on. When we think about the poron dewormers, one thing nice about a poron dewormer is we don't necessarily need to catch that animal in the squeeze chute. So when we think about treating cattle late May or June, pretty hot that time of year generally, most of us, if we can help it, want to avoid having to catch those cows in the squeeze chute. So if we want to optimize our deworming time, one nice thing about that poron dewormer is we can just put those cows in the lead up behind the squeeze chute and treat them, just put that poron down their back without ever having to catch them in the squeeze chute. Now, we don't want to be sitting there and as the cows run by us, try to squirt them when they're running out of gate or something. We do want to get them confined so we can apply that poron product correctly. Some other things we want to think about is, do we have any restrictions from a rain standpoint? What's the slaughter withdrawal? And are there any flammability concerns? And so some nice features about both Epernex and Cydectin is we don't have to worry about rain. There's zero slaughter withdrawal. And if you're branding cattle, they're non-flammable as well. So have quite a bit of flexibility there. Now, normally from a slaughter withdrawal standpoint, if we were making culling decisions on teeth or palpation status, we would want to do that before we deworm. But a lot of times you get in a hurry and everybody's doing it at the same time. And so if you ended up deworming an animal that you were going to end up culling, the nice thing is without any slaughter withdrawal in these two products, you have that flexibility to go ahead and send those animals to market right away. In contrast, when we look at some of our other products, there is a slaughter withdrawal. So Dectamax, there's no rain concerns there, so similar to the previous two. but there is a 45-day slaughter withdrawal. And if you're branding with a hot iron, those products are flammable. So make sure that you brand and then apply the Dectomax or one of the generic equivalents to Dectomax in that situation. Then when we look at brand named Ivomec, no rain for at least 6 hours, 48-day slaughter withdrawal, and it, as well as its generics, are going to be flammable as well. I would tell you, if you are using Ivomec, you may consider switching to Epernex. They're sold by the same company, and we know that Epernex is definitely a better product than the Ivomec is. So if you are using Ivomec, that's something to think about, is go ahead and switch into Epernex. It gives you some more flexibility, and it's also a more efficacious product. Another thing to be aware of is slaughter withdrawal is not always the same depending on whether the product's an injectable or a pour-on. So if we look at Cydectin on the brand name product, 0 slaughter withdrawal on the pour-on, 21 days for the injectable. Epernex pour-on 0. There's not an Epernex injectable. There is a long-range injectable, which is the same active ingredient. It's going to have a 48-day slaughter withdrawal on it. Dectomax is going to be 45 on the pour-on, 35 on the injectable, and Ivomec brand name is going to be 48 on the pour-on, 35 on the injectable. One thing is, if you're looking at cost and wanting to be mindful of that, is it makes a big difference depending on the quantity of product you buy at a time. So this is a price comparison to treat a 1,300-pound animal. I pulled these prices for the same product earlier this afternoon. If you bought a half-liter bottle to treat a 1,300-pound cow, it would be almost $11. That same treatment for the 1,300-pound cow, if we bought a 10-liter jug, drops the cost all the way down to $4.13. So big savings there just by buying a little bit larger quantity that we're going to use in that situation. So when we do have treatment failures, what causes those failures sometimes, and what would we want to be mindful of from a resistance standpoint? So first of all, I told you we have seen some issues with ivermectin. And one of the reasons is ivermectin actually comes from a group of compounds that we call avomectins, and there's 8 different versions of those. And what ivermectin actually is a mixture of those 2 avomectins. It's a B1A and a B1B. And if you get those out of a very specific ratio, we don't see the same efficacy there. And with the generic products, they don't necessarily have to prove that they have the same ratio as what the original Pioneer product did. In addition, we may have different carriers with some of the generics versus the Pioneer product. So that's some of the reasons we saw some of the failures with some of the generic ivermectin type products. As I was mentioning, the generics don't have to be exactly the same as the original product. So carriers can differ, concentration of the ivermectin compounds can differ a little bit, and sometimes even the concentration of the other active ingredients may be slightly different. There's some really good work out of Arkansas that showed some problems with some of the generic Ivomex. Plus, we saw some major field failures as well. So how do we avoid treatment failures? A big thing is we don't want to underdose. We want to make sure we get that animal dosed correctly. If you're only going to use one setting for the entire group of cows you're going to work that day, make sure you set it to the heaviest animal in the group so that we don't underdose anything. We want to make sure we select and use the most efficacious products. So our first generation versus our second generation of macrocyclic lactones, we know the second generation products are better. When we look at some of the newer generics for these second generation macrocyclic lactones, we just don't have the data on them to know how they're going to compare to some of the brand name products. They may work great. We may see less efficacy out of some of them. Just don't have that information yet. Then we need to make sure we apply that product correctly. So if we're using an injectable product, make sure we apply it correctly, and especially if we're using a pour-on product, make sure we get it down the back of that animal and get the full dose on the animal and not part of the dose on the ground. The other thing we don't want to do is use dewormers as our routine fly control products. So if we're going to deworm twice a year and we can get some fly control benefit out of that pour-on dewormer, that's great. But what we don't want to do is take one of the dewormers and use it multiple times throughout the season as a primary fly control product that can potentially create a greater risk of resistance developing to those dewormers. The other thing is when people talk about resistance, it's really important that they need to specify what species of worms they're talking about. Because with the Cooperia species, our macrocyclic lactones didn't work very good on Cooperia species when they were first released. So to me, it's not that we've developed resistance to Cooperia, we just never had very good control of Cooperia in the beginning. And a lot of times when people are talking about resistance, that's the species they're talking about. So really, if you're having that discussion with somebody, make sure they're talking about Cooperia, they talking about Ostertagia, they talking about Haemonchus placei, or what species are we talking about there? We don't want to underdose those animals. That can lead to a greater risk of resistance there. There are resistance issues with Ostertagia in some other countries that have been well documented. There are some reports in the US, but not as quite as many reports as we've seen in some other countries. At this point in time, there's really no data to suggest that rotating drug classes is beneficial. Most folks out there in the industry at this point in time are not recommending any kind of rotation for those products. What is being recommended at certain situations is the use of two drug classes at the same time. We talked about that, especially in those calves less than a year of age around that weaning time. We don't want to apply the dewormers too frequently, even in our high rainfall areas. Twice a year is probably sufficient in most situations, or we don't need to be going more often than that. And then we do want to be mindful of bringing in problems with new cattle. So one thing you may want to do as part of your protocol when you bring any new animals in is go ahead and make sure you treat them with two different drug classes to make sure you get all the worms out of those animals so they're not bringing in problems to your operation. There's a lot of talk about testing out there, and it's important that we understand some of the pros and cons of testing. And what the testing really tells us is with the fecal egg count. And so they're just collecting a fecal sample and then they'll analyze it under a microscope and typically report so many eggs per gram of sample. We have to be really careful to understand how we interpret that and what that actually tells us. And so with fecal egg counts, unlike some worms and other mammalian species in cattle, we can't distinguish most of those species just by looking at the eggs under a microscope. So when we get a fecal egg count, are we seeing a lot of eggs from a species of worm that doesn't cause us a bunch of problems, or what's the situation there? What's a little more useful rather than just a single fecal egg count by itself is what's called a fecal egg count reduction test. And that's done to look at product efficacy. And so what you would want to do there is take a sample from so many animals before you treat, take a sample from so many animals after they're dewormed, and then look at what was the reduction in worms there. And so that does tell us quite a bit more. It still doesn't tell us the whole story, though, in some situations, because sometimes shedding of eggs varies. So that can influence that test as well. To really know what species we're dealing with, we have to do what's called a culture, which they actually hatch out those eggs and then identify the larva. Or there's some DNA techniques that some folks are using to help get an indication of kind of the mix of the eggs there. So testing, unfortunately, doesn't tell you the whole story. When we think about developing a strategic deworming plan, those recommendations are going to vary depending on who you talk to. What I'm going to refer to as kind of the traditional recommendation out there was to try to reduce the number of parasites on the pasture as much as possible, which means we're going to treat every animal in the group and try to treat them at the time that's going to be most effective to reduce pasture numbers. Kind of a newer recommendation that's come out the last several years is a strategy called refugia. We'll talk about it a little bit more on the upcoming slides. Really important to know that that strategy has not been proven at this point in time. As we think about moving forward, plans in some situations may need to be more customized, especially if you're a stocker operator and bringing cattle in like that, or if we're in a situation where we've had some problems in the past or something like that. And so you may need to work with a parasitologist, a veterinarian, or some other industry expert to customize a program moving forward. That's not going to apply to most people, but in certain situations, that may be the case. So when we think about refugia, what that is meaning we're going to leave a certain amount of those animals untreated. And so theoretically, some of the worms have never been exposed to the dewormer. And so they can breed with worms that have, and hopefully keep the population more susceptible to the dewormer moving forward. It has not been proven to work in cattle at this point in time. It is just a theory to reduce resistance. Not deworming some of the cows is probably not such a huge deal, but you're going to have to not deworm some of the calves as well. And do we really want to give up the performance by not deworming some of those calves for a strategy that has not been proven yet at this point in time? I'm going to tell you personally, I'm not willing to go down that route. That's a decision each producer has to make for themselves. The other thing is if you do use the refugia strategy where you're not going to treat all the animals, then you need to think about how are you going to control grubs in those untreated animals, which that becomes a little bit more of a challenge there. The other thing is how do you control lice when you get rid of that deworming treatment in the winter there, which that's a little easier, but probably means you're going to have to treat some animals with your dewormer, and then for lice, some of your animals with a different product, but the grubs really become a challenge. So that's what I wanted to cover, in regards to our gastrointestinal nematodes. Next thing we're going to spend a little bit of time talking about would be liver flukes, which is another internal parasite. There's actually two types of liver flukes. There's the common fluke and then the deer fluke. The deer fluke in cattle are considered a dead-end host for deer flukes, meaning those eggs are going to be trapped in the liver. And so there won't actually be any egg shedding or reproduction that occurs, but we still have damage to that liver, which can be a problem with the deer flukes. And then obviously common flukes, they're going to reproduce and shed eggs. There are some reports of fluke problems starting to become a little bit more widespread than they were at one point in time. So just something to be mindful of moving forward. When we think about the life cycle of a liver fluke, those adult liver flukes are going to start producing eggs roughly 10 to 12 weeks after that animal is infected. Those eggs are going to be passed in the manure. Those eggs will hatch out, and then if we have water, we'll help those larvae actually try to find an intermediate host. So those larvae have to go from an egg, those eggs have to hatch, develop into a larva. That larva then has to find a snail, specific type of snail, and then they infect that snail and they reproduce while they're in that snail. And then they will come out of the snail and they will develop into a cyst that will get on the blade of grass. When that cow eats that encysted larva on that grass, that's when they become infected. That life cycle typically takes 4.5 to 6 months. And so it has to go through that snail. And so that's why in some areas we just don't have the problem with the flukes because we don't have the water that's needed or we don't have the snail that's needed in that situation. Historically, where we've thought about problems in Texas, would be along the border between Texas and Oklahoma, and then more in our Gulf Coast and along some of our major river tributaries going down to the Gulf Coast there as well. When we think about liver flukes, the ideal time to treat is going to be September to November. We used to have 3 products. The Curatrim product is no longer on the market, so that leaves us with Valvacin, Ivomec Plus, or the generic versions of Ivomec Plus. I bring up Curatrim because even though Curatrim and Ivomec Plus have the same active ingredient, it's at a much lower concentration in Ivomec Plus, and so that impacts what stage of liver flukes we can kill. So when the Curatrim product was on the market, it was labeled for treatment of both immature and adult liver flukes in cattle. It had a concentration of 7 milligrams per kilogram of chlorsolon. In contrast, Ivomec Plus only has 2 milligrams per kilogram, and it's only going to be labeled for adult liver flukes. It's not going to get any of the immature liver flukes. Some recommendations from retired parasitologist Dr. Tom Craig out of College Station is when we did have Curatrim, it tended to be effective on those flukes once they got over about 8 weeks. And so that's why we could get control of some of those immatures as well. Valvacin does have some efficacy against adults of both common and deer flukes. And then Ivomec Plus is really going to only be effective against common liver flukes 12 to 16 weeks after infection. So if you're after deer flukes too, Valvacin is probably going to be your option there. One thing is if you are in an area that has liver fluke problems, you definitely want to make sure you're using a clostridial vaccine that contains Clostridium hemolyticum. That's a Clostridia bacteria that when those liver flukes damage the liver can cause some major problems in cattle, and typically they will lead to death. If you're unsure, when we look at the cost difference between a Clostridial vaccine, typically the 7-ways don't have the Clostridial hemolyticum in them. Most of the 8-way Clostridial vaccines will have the Clostridial hemolyticum in it. Typically, you're talking about maybe a nickel difference in those products with and without, and I've even seen some situations where they were the same price. So if you're unsure, probably a good strategy is just to go ahead and make sure to include Clostridium hemolyticum in your Clostridial vaccine that you choose. And with that, I'll be happy to take any questions that anybody has. Feel free to go ahead and put those in the chat box, or you can go ahead and unmute and ask those questions. So any questions about tonight's topic or any other beef cattle related topics? Okay, another question came in about operation that hasn't had any cattle for a couple of years, but had some horses. Should they be concerned about worms there? So likely the place should have pretty limited or no worms from a cattle standpoint, because the horses, the worms that infect horses are going to be different from the worms that will affect cattle. I will tell you though, even though there haven't been any cattle in there for a couple of years, when you bring cattle on there, those cattle likely have some worms, so they're going to put some worms on those pastures. So if you can deworm those cattle before you take them there, that'll just mean less worms you're going to have to deal with moving forward. All right, well, I'm not seeing any other questions. I do want to thank everybody for joining tonight and hope you have a good evening.